welcome to my channel. So today we'll be talking about low sex drive in women, causes of low sex drive and treatment of low sex drive. Please, if this is your first time of coming across my channel, do well to subscribe, like, comment and share. Thank you. So women's level of sexual desire change over the years. It's common for high and lows to happen along with start or end of relationship, or they can happen with major life changes such as pregnancy. So pregnancy can cause low sex drive. Some people, if they get pregnant, they will start experiencing low sex drive. Some people will experience high sex drive, but body differs. So number one causes of low sex drive is pregnancy. Pregnancy can cause low sex drive. Okay, another cause of low sex drive is menopause or illness. Menopause or illness can cause low sex drive. Some medicines used for conditions that affect mood also can cause low sex drive. So there are some medications that can also cause low sex drive. Because there sometimes you will be having some sickness. What will come to your mind that moment is how to get yourself, how to get treatment, and from the diseases you're suffering from. So in that moment you won't be thinking about having sex or whatever. So illness can cause low sex drive. Pregnancy can cause low sex drive. Some people, if they get pregnant, they will not like their partner to come closer to them at all. So some people will get low sex drive when they are pregnant. Some certain medication like cancer medication can cause low sex drive too. So if your lack of interest in sex continues or returns and causes personal distress, talk with your healthcare professional. You may have a treatable condition called sexual interest arousal disorder. So if you are experiencing low sex drive, you can visit your gynecologist for treatment. But you don't have to meet this medical definition to seek help. If you are bothered by a low or reduced sex drive, you can take steps to boost your libido. Lifestyle changes and sexual techniques may put you in the mood more often. Some medicines may offer promise as well. So if you are experiencing low sex drive, talk to your partner about it. Tell your partner where to touch you so that you'll be able to get aroused. Remove your mind from anything that is bothering you. So try and concentrate. Okay, thank you for those that are joining me now. Thank you. Okay. So some certain medication can cause low sex drive. Symptoms of low sex drive. Neither of you may have a sex drive that's outside what's typical for people at your stage in life. And even if your sex drive is lower than it once was, your relationship may be strong. So there is no magic number to define low sex drive. It varies. Symptoms of low sex drive in women includes having less or no interest in any type of sexual activity, including masturbation. So one of the symptoms of low sex drive is having less or no interest in any type of sexual activity, even if it's masturbation. So number 2, never or only seldom having sexual fantasies or thoughts. Number 3, being sad or concerned about your lack of sexual activity or fantasies. So if you're worried about you if you're worried about not having sex drive, about not having feelings for your partner, it can also cause more low sex drive. So it's better you meet your medical professional to diagnose and treat you properly, or seek counsel. When to see a doctor. If you are concerned about your low sex desire, talk to your gynecologist or other health professional. The answer might be as simple as changing a medicine that you take, or you may need to get a condition such as high blood pressure or diabetes under tighter control, as those things can also cause low sex drive. Okay, so desire for sex is based on complex mix of many things that affect intimacy. This factor includes physical and emotional well-being, exercise, beliefs, lifestyle, your current relationship. So this can also cause low sex drive. If you have challenges in any of these areas, it can affect your desire for sex. Physical causes. A variety of illness, physical changes, and medicine can cause low sex drive, including sexual condition. If you have pain during sex or can't orgasm, it can lower your desire for sex. Diseases. Many non-sexual diseases can affect sex drive. This includes cancer, diabetes, high blood pressure, coronary artery disease, or neurological disease. Number 3, medicine. Some prescription medicine lowers sex drive, especially depression medicine called selective serotonin. So some medicine can cause low sex drive. Lifestyle habits. A glass of wine may put you in the mood. Okay, but too much alcohol can affect your sex drive. The same is true of street drugs. Also, smoking decreases blood flow, which may dull arousal. Surgery. Any surgery related to your breast or genital tract can affect your body image, sexual function, and desire for sex. Fatigue. Exhaustion from caring for your young children or aging parents can contribute to low sex drive. Fatigue from illness or surgery can also play a role. So these are the physical causes of low sex drive. In-home changes in your hormone changes. Changes in your hormones level may desire for sex. This can occur during menopause. Estrogen level drop during menopause. This can make you less interested in sex and cause vaginal dryness, leading to painful or uncomfortable sex. Many women still have satisfying sex during menopause and beyond, but some have a lagging libido during these hormone changes. So menopause can also cause low sex drive. Pregnancy and breastfeeding. Hormone changes during pregnancy, just after having a baby, and during breastfeeding can put a damper on sex drive. Fatigue and changes in the body image can affect your sexual desire. So, can the pressure of pregnancy or caring for a newborn baby cause low sex drive? Physical causes. Your state of mind can affect your sexual desire. Psychological causes of low sex drive includes Mental health conditions such as anxiety or depression can cause low sex drive. Stress tied to things such as finances, relationship, or work can also cause low sex drive. Poor body hygiene can also cause low sex drive. Low self-esteem can also cause low sex drive. History of physical, emotional, or sexual abuse can also cause low sex drive. Past negative sexual experiences can also cause low sex drive. So another thing that can contribute to low sex drive is relationship issues. For many people, emotional closeness is the key to sexual intimacy. So problems in your relationship can be a major factor in low sex drive. Often less interest in sex is a result of ongoing issues such as lack of connection with your partner, unresolved conflicts or fights, poor communication of sexual needs and desire, trust issues, concern over your partner's ability to have sex, not enough privacy. So, in relationship aspects, these things I mentioned here can cause low sex drive. So, risk factors that can raise the risk of low sex drive includes: hi, please, I can see some people online. If you are hearing me, give me a thumbs up. Could I stand up, please? No, I cannot stand up. Andy Rose, could you stand up, please? Are you not seeing me? Are you seeing me? Someone said, could you stand up, please? Hope you are seeing me. Okay. So, risk factors that can raise the risk of low sex drive include conditions such as diabetes, high blood pressure, and coronary artery disease, pain during sex or not being able to orgasm, mental health condition and life circumstances that affect your state of mind, various prescription medicines, including depression medicine called selective serotonin reuptake inhibitors, surgeries related to the breast or genital tract, changes in hormone level during menopause, pregnancy, or breastfeeding, relationship issues that lessens emotional closeness. So, these things can cause low sex drive. If you're having a low sex drive, visit a professional medical personnel for proper diagnosis and treatment. So, please, if you have any questions to ask me about sex drive, feel free to ask your question. So, let's talk about male low sex drive. Males low sex drive. Male low sex drive. So, Low sex drive or libido may stem from low testosterone, lack of sleep, stress, substance use, and more. If changes in your sex drive concern you, a doctor can offer more guidance. So, your doctor can offer more guidance. Low libido describes a decreased interest in sexual activity. However, low libido for a long period of time can sometimes be an indicator of an underlying health condition. Here are a few potential causes of low libido in male. Low testosterone. Testosterone is an important male hormone that's mostly produced in the testicles. It plays a key role in sperm production, sex drive, puberty, muscle building, bone health, etc. So, healthy testosterone level for male ranges between 450 and 600 milligrams per deciliter, according to the American Urological Association. However, adult males are considered to have low testosterone if levels fall between 300 mg/dl. When your testosterone levels decrease, your desire for sex decreases. Decreasing testosterone is a normal part of aging, but a drastic drop can lead to decreased libido. Speaking with a healthcare professional, if you think this might be an issue for you, they could provide a proper diagnosis and recommend supplements or gels to increase your testosterone levels. Medication. Taking certain medication could lower your testosterone levels, which in turn leads to low libido. According to the International Society for Sexual Medicine, this may include high blood pressure medicines. High blood pressure medicines can cause low libido in men. Certain antidepressants, chemotherapy or radiation treatment for cancer, opioids, pain reliefs, and antifungal medication called ketoconazole, cimetidine, tagamet, which is used for heartburn and gastroesophageal reflux disease. If you are experiencing the effect of low testosterone and take any of these medicines, speak with your doctor. They may advise you to switch medication. Depression. Depression may lead to reduced or complete lack of interest in activities you once found pleasurable, such as sex. Low libido is also a side effect of some antidepressants, including selective serotonin inhibitors, including NSAIDs. Some NSAIDs can cause low sex libido. Chronic illnesses. Chronic conditions that may affect sexual desire include heart diseases, chronic obstructive pulmonary disease, type 2 diabetes, chronic pain, cancer, obesity, high blood pressure, high cholesterol, chronic lung heart disease, and liver failure. So, all these diseases can also lead to low sex drive. If you are living with a chronic condition and are sexually active, it's important to be open about ways to be intimate and supportive. You may also consider speaking with a sex therapist. Sleep problems. Several sleeping disorders and conditions that could affect your sleep are associated with decreased libido, erectile dysfunction, and low testosterone levels. This may include obstructive sleep, insomnia, cardiac arrest, frequent urination at night. So all this can lead to low sex libido, low sex drive rather. Aging. Testosterone levels, which are linked to libido, are at their highest during adolescence and gradually decreases as you age. This could lower your sex drive, and you may find it more difficult to orgasm, ejaculate, become aroused, have or maintain erection. So a healthcare professional could recommend a treatment plan to help manage low sex libido and testosterone levels. Stress. If you are distracted by situation or periods of high pressure, sexual desire may decrease. Research suggests that an increase in cortisol, or also called the stress hormone, could disrupt hormone level, lower libido, and increase your risk of erectile dysfunction. So similarly, a 2019 study found that stress and personal burnouts were associated with lower sex drive, erectile dysfunction, and decreased sexual satisfaction in male. Some stress management techniques such as breathing exercise, meditation, and talking with a therapist may help improve your libido. Low self-esteem. I'm talking about causes of low. Thank you. I'm talking about low. I am 14. How do I get rid of 104 Fahrenheit fever? So, Pretty Ivy, have you gone for test? Have you gone for test to know why you are having a high temperature? Pretty Ivy says, I am 14 and how do I get rid of 104 Fahrenheit fever? You have to know the cause of the fever before thinking of medication to take. Go run some tests to know the cause of the fever, so in order to know the medication you will take. Okay, thank you very much. So I'm talking about low sex drive in male. I've talked about low sex drive in female, so now I'm talking about low sex drive in male. So one of the causes of low sex drive in male is low self-esteem. Self-esteem is defined as a person's general opinion about their own self. Low self-esteem could take a toll on your sexual, emotional, and physical well-being. It may also cause anxiety about sexual performance, which could lead to issues with erectile dysfunction, reduced sexual desire, and avoiding sex altogether. So low self-esteem can also cause low sex drive. Low self-esteem, I mean, some people will be like, look at me, I'm ugly, I'm not tall, I'm not fine. In that case, causing low self-esteem. So this could also lead to low sex drive. Over time, self-esteem issues can result in larger mental health problems such as depression, anxiety, and drug or alcohol misuse, all of which have been linked to low libido. For instance, too little exercise or none at all can lead to a range of health problems that can affect sexual desire and arousal, such as obesity, high blood pressure, type 2 diabetes, stroke, high cholesterol, mental health disorders. On the other hand, over-exercising has also been shown to affect sexual life. So, higher levels of intense and lengthy endurance training on a regular basis were strongly associated with decreased libido scores in male. So, I recommend getting at least 150 minutes of moderate intensity exercise of 75 minutes of high intensive exercise weekly. So, heavy alcohol can also cause low sex drive. Heavy alcohol drinking or more than 15 drinks in a week is even too much. In a week is associated with a decrease in low testosterone over a long period of time. Excessive amount of alcohol can reduce your sex drive and lead to erectile dysfunction. So, too much of alcohol, high intake of alcohol can lead to low sex drive, low libido in male. Okay. However, it's important to note that even drinking one or two drinks daily doesn't provide benefits to health and longevity, as has been believed for years. So, some people believe that taking alcohol could Pretty Ivy, hope you understood what I said. I said you have to know the cause of the high fever you are getting before you can start treatment. So try and go for tests so that you will know what's actually causing the high fever, so that you can get a proper treatment. Thank you. So, drug use. In addition to alcohol, the use of some substance and illegal drugs may lower your testosterone levels and affect sexual desire. This may include antibiotic steroids, cannabis, nicotine, amphetamines. All these can cause low sex drive. Physical and emotional side effects of low libido. A decreased sex drive can be very unsettling. Low libido can lead to a vicious cycle of physical and emotional side effects such as stress, low self-esteem, erectile dysfunction, anxiety around sex, relationship problems. If you experience low libido and it's affecting your daily activity and mental well-being, speak with a healthcare professional. They could help develop a plan to increase your sex drive, which may include lifestyle and dietary changes, therapy, counseling, and group support, medications such as testosterone replacement therapy, TRT. So, I suggest if you are having low libido, it's best to see a professional medical personnel for proper diagnosis and treatment. So if you have questions, you can ask me. So, alcohol intake. Some men believe that if they take alcohol, they will be able to perform better. But too much intake of alcohol can actually cause low libido. Too much intake of alcohol can cause low libido. Too much intake of nicotine can cause low libido. Too much intake of some certain medication can cause low libido. So, too much intake of self-medication. We're always telling people to stop self-medicating. Self-medication, taking some certain medicine can cause low libido. Some certain treatments, prescribed medicine, can also cause low libido in male too, like cancer treatments can cause low libido too. So, if you're having a low libido, do well to seek a professional medical help. Thank you. So our next topic is going to be now. Please, if you have any question, you can ask me on the issue we discussed about today. If you have any question, do it ask me and I will attend to you quickly. So today we are going to discuss about breast pain. We are going to talk. We've discussed about low sex drive in female. We have discussed about low sex drive in male. So now we are going to discuss about breast pain. What can cause breast pain? So some people do ask me what can cause breast pain. I do notice my breast do pain me every month. I do notice that my breast do pain me before my period comes. I do notice that my breast pains me after my period comes. Please, what can cause breast pain? I'll be getting a lot of questions concerning breast pain. So I want to treat that case today. Breast pain. What can cause breast pain? Breast tenderness. So if you're having breast pain, if you always have breast pain, come closer because this topic is for you. What can cause breast pain? So 10 reasons your breast may hurt. 10 reasons your breast. Some people do get nipple pain, all around breast pain. Some parts might be paining you, all over your breast might be paining you. But if you're having breast pain, listen carefully. Breast pain. Most women experience breast pain. Most women experience some form of breast pain at one time or another. Breast pain is typically easy to treat, but on rare occasion it can be a sign of something more serious. So medical directors of some hospital, hormones are making your breast sore. One of the causes of breast pain is hormonal changes. So hormones are making your breast sore. Hormonal fluctuation are the number of reasons women have breast pain. Breast becomes sore 3 to 5 days prior to the beginning of your menstrual period and stop hurting after it starts. So this is due to a rise in the estrogen and progesterone right before your period. These hormones cause your breast to swell and can lead to tenderness. It's normal to have breast tenderness and that comes and goes around the time of the period. So if you're having breast pain, maybe mostly every month, if you notice you're having your breast usually pain you every month, it might be due to ovulation or your period is about to start. So if you become pregnant, your breast may remain sore during the first trimester as hormone production ramps up. So if you are pregnant, that's one of the symptoms of pregnancy. If you are pregnant and you notice that your breast is paining you, just know that was one of them. You don't have to be worried. That's one of the symptoms of pregnancy. If you become pregnant, your breast may remain sore during the first trimester as hormone production ramps up. Breast tenderness is one of the earliest signs of pregnancy for many women. So, steps you can take to minimize sore breast include eliminate caffeine. Eat a low-fat diet. Reduce salt intake. Avoid smoking. Take an over-the-counter pain reliever. Ask your doctor if switching birth control pills or hormone replacement therapy medication may help. So, these are number one step to take. If you are smoking, you have to quit smoking. If you are taking much alcohol, you have to stop. Reduce intake of salt, like too much intake of salt. Take an over-the-counter pain reliever. Then ask your doctor if switching birth control pills or hormone replacement therapy medication may help. Number 2, you have a breast injury. Like any part of your body, breast can be injured. This can happen because of an accident, while playing sports, or from breast surgery. You may feel a sharp shooting pain at the time of injury. Tenderness can linger for a few days, up to several weeks after trauma to the breast. See your doctor if the pain doesn't improve or you notice any of these signs. Okay, so severe swelling, a lump in the breast, redness and warmth which could indicate infection, a bruise on your breast that doesn't go away. If you notice these things that I mentioned now, do well to see your doctor. Visit your doctor for proper examination. Number 3, your breast hurts due to an unsupportive brazier. Your breast hurts due to an unsupportive bra. Without proper support, the ligaments that connect breast to the chest wall can become overstretched and painful by the end of the day. The result is achy, sore breasts. This may be especially noticeable during exercise. Make sure your bra is the correct size and provides good support. So, some people that don't put on bras, you notice that your breast is pulling down, stretching the muscle between your chest and your breast tissue. So, wearing a fitting bra can prevent breast pain. Breast pain is really coming from your chest wall. So, what feels like breast pain may actually be coming from your chest wall. This is the area of muscle, tissue and bone that surrounds and protects your heart and lungs. Common cause of chest wall pain include a pulled muscle, inflammation around the ribs, trauma to the chest wall, hitting it in the chest, trauma to the chest wall, bone fracture. All this can cause breast pain. Breastfeeding is causing breast tenderness. If you are breastfeeding, it can also cause breast tenderness. Sometimes be the source of breast pain. Some of the things you can experience while nursing include painful nipple from an improper latch, the way a baby latches onto socks. So, tingling sensation during let down when the milk starts to flow to the baby. Nipple soreness due to being beaten or having dry, cracked skin or an infection. So, all these can cause breast pain. If you have pain while breastfeeding, it's best to talk to your doctor or a lactation consultant. They can help you troubleshoot the problem while maintaining your milk supply. You have a breast infection. Breastfeeding women are most likely to get breast infection. but they occasionally occur in other women too. If you have a breast infection, you may have a fever and symptoms in one breast, including pain, redness, and swelling. So if you think you might have a breast infection, it's important to see a doctor. Treatment typically includes antibiotic and pain relievers. 7. Breast pain could be a medication side effect. Breast pain could be a medication side effect. Some medication may cause breast pain as a side effect. Talk to your doctor about the medication you are on if this could be the case of you. So, some drugs with these known side effects include oxymetone, used to treat some form of anemia. Chlorpheniramine, used to treat various mental health conditions. Water pills, diuretics, drugs that increase urination and are used to treat kidney and heart diseases and high blood pressure. Hormone therapies, birth control pills, hormone replacement or infertility treatment can cause breast pain. If you are taking some hormonal drugs, maybe because of infertility, or birth control pills, it can also cause breast pain. Some medication prescribed for heart failure can also cause breast pain. Methyl dopa, used to treat high blood pressure, can also cause breast pain. Number 8, you have a painful breast cyst. How to do breast examination on your own. You used to check breast around like this. Use your right hand to press on your breast to know if there is any lump around your breast area. If there is any lump around your breast area, or cyst, any lump or cyst around your breast area. If a tender lump suddenly appears in your breast, you may have a cyst, says Wright. These fluid-filled lumps aren't dangerous and often don't need to be treated, as they may resolve on their own. But it's important to get any lump in your breast evaluated by a doctor. So, if you notice any lump in your breast, or hotness or redness around your breast area, it's important to see your doctor. Don't just take pain relief to stop it, or you start applying stuff on it. It's important to seek a medical help. So, if you notice any of this I mentioned, try and see your doctor. To diagnose a cyst, your doctor may recommend a mammogram, ultrasound, or aspiration, that is drawing fluid from the lump. Draining fluid from the cyst is also a form of treatment. The cyst isn't bothersome. You may not need any treatment at all. So that's why I said it's important to see your doctor. Number 9, you are experiencing painful complication from breast implants. Some people that usually do breast enlargements. So some women have complications with breast implants, whether made of silicone or saline. One of the most common causes of pain after breast augmentation surgery is capsular contracture, when scar tissue forms too tightly around the implant. Breast pain can also be an indication that one of your implants has ruptured. Talk to your doctor about any pain you are having to determine if it could be related to the breast implants. For those that are doing breast implants, you know what I mean, breast enlargement. Number 10, breast pain can sometimes be a sign of breast cancer. Breast pain can sometimes be a sign of breast cancer. What did I say? Breast pain can sometimes be a sign of breast cancer. It's usual for breast cancer to cause pain, says Wright, but not impossible. Inflammatory breast cancer often causes pain, but it's rare, accounting for 1% to 5% of breast cancer cases in the states. Symptoms of aggressive diseases often come on suddenly and progresses rapidly. Inflammatory breast cancer may cause the breast to become red or discolored, swollen or heavy, painful. 2. Skin on the breast may also thicken or dimple. If you are concerned about inflammatory breast cancer, see your doctor immediately. So, if you notice any of these I mentioned, do well to see your doctor for proper diagnosis and treatment. When to see a doctor for breast cancer? Although most cases of breast pain are minor problems, it's important to talk to your doctor about your concerns. If you have persistent breast pain, you should be evaluated, and anyone who has a lump, painful or not, should see their doctor for exam to make sure there isn't a problem. Thank you. So like I said before, if you want to check for lumps or cysts on the breast, lie on your back, use your right hand to check the left breast, press round the breast to see if you notice any lump or cyst around your breast area. Then use your left hand to check your right breast. Use your left hand to check your right breast. Go around it to see if you notice any lump or cyst on your breast. So, if you have any question about breast pain, go ahead and ask. Thank you. So, another topic for today is going to be milk discharge from the breast. Breast milk discharge. So, galactoria is a milky nipple discharge. We are going to talk about breast milk discharge when not pregnant. You're not pregnant, but you're lactating. You're not pregnant, but milk is coming out from your breast. So, we are also going to discuss about that today. Galactoria, which is a milky nipple discharge unrelated to the usual milk production of breastfeeding. Galactoria itself isn't a disease, but it could be a sign of another medical condition. Breast milk discharge could be another sign of medical condition. It usually happens in women, even those who have never had children or who had gone through menopause, but breast milk discharge can happen in men and babies. Excessive breast stimulation, that is pressing your breast more often, excessive breast stimulation, medicine side effects or condition of the pituitary glands, all may contribute to galactoria. Often, breast milk discharge results from increased levels of prolactin. The hormone that stimulates breast milk production is called prolactin. Sometimes the cause of galactoria can't be determined. The condition may go away on its own. So, symptoms of breast milk discharge include milky nipple discharge that may be constant or it may come and go. nipple discharge involving multiple milk ducts, spontaneously leaked or manually expressed nipple discharge from one or both breasts, absent or irregular menstrual period, headache or vision problems. So these things I mentioned now are symptoms of breast milk discharge. When to see a doctor if you're having breast milk discharge? If you have a persistent spontaneously milk nipple discharge from one or both of your breasts and you are not pregnant or breastfeeding, make an appointment to see your healthcare professional. If breast stimulation such as excessive nipple manipulation during sexual activity triggers nipple discharge, if your partner is suckling on your breast or pressing on your breast while making love, it can also lead to nipple discharge from multiple ducts. You have little cause of worry. The discharge probably doesn't signal anything serious. This discharge often goes away on its own. If you have persistent discharge that doesn't go away, make an appointment with your healthcare professional to get checked out. Okay, non-milky nipple discharge, particularly bloody, yellow or clear spontaneous discharge that comes from one duct or associated with a lump you can feel, requires prompt medical attention. It may be a sign of an underlying breast cancer. So if you notice any form of breast milk discharge and you're worried about it, or it's becoming much, or you didn't press your breast but you're lactating, please do well to see your medical professional. So galactorrhea often results from having too much prolactin in the body. Breast milk discharge often results from having too much prolactin in the body. Prolactin is a hormone responsible for milk production after a baby is born. Prolactin is made by the pituitary gland, a small bean-shaped gland that's at the base of the brain. That regulates several hormones. Possible causes of galactorrhea possible causes of breast milk discharge includes medicines such as certain sedatives, antidepressants, antipsychotics, and high blood pressure drugs. Opioids use, herbal supplements such as fennel or fenugreek seed, birth control pills, a non-cancerous pituitary tumor called prolactinoma, or other conditions of the pituitary gland. Underactive thyroid called hypothyroidism, chronic kidney disease, excessive breast stimulation which may be associated with sexual activity, frequent breast self-examine with nipple manipulation or prolonged clothing friction. Nerve damage to the chest wall from chest surgery, burns, or other chest injuries, spinal cord injuries, or trauma. Nipple discharge in men. In males, nipple discharge may be associated with testosterone deficiency called the male hypogonadism. This usually happens along with breast enlargement or tenderness called breast enlargement, erectile dysfunction, and a lack of sexual desire also are associated with testosterone deficiency. Breast milk discharge in newborn. Breast milk discharge in newborn. Hope you know that newborns do have breast milk discharge too. So breast milk discharge sometimes occurs in newborns. High maternal estrogen level cross the placenta into the baby's blood. This can cause enlargement of the baby's breast tissue, which may be associated with a milky nipple discharge. This milky discharge is temporary and goes away on its own, so you don't have to worry about that. If you give birth and your newborn is lactating, breast milk is coming out from your baby's breast, please, you don't have to be worried. So it usually goes away on its own. If the discharge is persistent, the newborn should be evaluated by healthcare professional. Risk factors. Anything that triggers the release of the hormone prolactin increase the risk of breast milk discharge. Risk factors include certain medicines, illicit drugs, and herbal supplements. Those that will go and carry herbal medicine and be given to their babies. Condition that affects the pituitary glands, such as non-cancerous pituitary tumor, certain medical conditions such as chronic kidney disease, spinal cord injuries, injuries to the chest wall, and the underactive thyroid, a lot of touching and rubbing of the breast, stress. So all these are risk factors. So in breast milk discharge, in summary, if you're having a breast milk discharge, you don't have to worry about it. If you as a lady is having breast milk discharge, you don't have to worry about it, except it's much, like you are not pregnant, you're not breastfeeding, but you're having nipple discharge and it's becoming much, or you are trying to conceive. Do well to see a medical professional for diagnosis and treatment. And men do also have breast milk discharge. Babies also do have breast milk discharge, which usually goes away on its own. So if you notice any of this, you don't have to be worried, because it usually goes away on its own. But if you are a lady or a woman trying to get pregnant, trying to conceive, and you are having breast milk discharge, I'll advise you go for prolactin test to make sure your prolactin level is normal. So because that could be one of the symptoms of high prolactin. Breast milk discharge can be the symptoms of high prolactin, which leads to infertility. So if you are trying to conceive, I advise you, if you're having breast milk discharge, go for checkups, go for tests to make sure that your prolactin level is on the normal. So if you have any question, do what to ask and I'll attend to you as soon as possible. So our next topic is going to be infertility. Our next topic is going to be infertility. Infertility in females. So if you're having any issue of infertility, come closer. So first of all, I'm going to talk about infertility in female infertility. So if you want to have more knowledge on female infertility, come closer, because this topic is for you. Infertility is defined as trying to get pregnant with frequent unprotected sex for at least a year with no success. Infertility results from female factor about 1/3 of the time, and both female and male factors about 1/3 of the time. The cause is either known or a combination of male and female factor in the remaining cases. Female infertility causes can be difficult to diagnose. There are many treatments depending on the infertility cause. Many infertile couples will go on to conceive a child without treatment. Symptoms. The main symptom of infertility is the inability to get pregnant, a menstrual cycle that's too long, 35 days or more, too short, less than 21 days, irregular or absent can mean that you're not ovulating. There might be no other sign or symptoms. When to see a doctor. When to seek help can depend on your age. Up to 35, most doctors recommend trying to get pregnant for at least a year before testing or treatment. So if you are up to 35 and above, it is recommended that you seek for medical help when you have tried for 1 year without success. So it is recommended. So if you are having infertility problem, it is recommended you seek a medical help. If you are up to 35 and above, you seek medical help. If you have tried for 1 year, 1 year of unprotected sex without success could mean you are having infertility problems. So you and your partner should seek for medical help if you have tried for 1 year. So I'm going to be mentioning the causes of infertility in female. So one of the causes of infertility in female is no ovulation. If you are not ovulating, a woman who doesn't ovulate will find it very difficult to conceive. So if you are not ovulating, do well to see a medical personnel, because without ovulation, a woman cannot conceive. Number 2, your doctor might also want to begin testing or treatment right away if you or your partner has known fertility problems, or if you have a history of irregular or painful period, pelvic inflammatory diseases (PID), repeated miscarriages, cancer treatment, or endometriosis. So all this can cause infertility. Causes of infertility. For pregnancy to occur, every step of the human reproduction process has to happen correctly. The steps in this process are: one of the 2 ovaries release a mature egg. The egg is picked up by the fallopian tube. The sperm swim up to the cervix through the uterus and into the fallopian tube to reach the egg for fertilization. The fertilized egg travels down to the fallopian tube to the uterus. The fertilized egg attaches implants to the inside of the uterus and grows. Female reproductive system. The ovaries, fallopian tubes, uterus, cervix, and vagina, can also called the vaginal canal, make up the female reproductive system. Fertilization and implants. During fertilization, the sperm and egg unite in one of the fallopian tubes for conception. Then the zygote travels down the fallopian tube where it becomes a morula. Once it reaches the uterus, the morula becomes a blastocyst. The blastocyst then burrows into the uterine lining and a process called implantation. In women, a number of factors can disrupt this process at any step. Female infertility is caused by one or more of the factors below. Ovulation, like I've mentioned before, ovulation disorder. Ovulating infrequently or not at all accounts for most cases of infertility. Problems with the regulation of reproductive hormones by the hypothalamus or the pituitary glands, or problems in the ovaries can cause ovulation disorder. Polycystic ovarian syndrome, PCOS. Polycystic ovarian syndrome causes a hormone imbalance which affects ovulation. PCOS is associated with insulin resistance and obesity, abnormal hair growth on the face or body, and acne. It is the most common cause of female infertility. Hypothalamic dysfunction. Two hormones produced by the pituitary glands are responsible for stimulating ovulation each month. Follicle stimulating hormone FSH and luteinizing hormone LH. Excess physical or emotional stress, a very high or very low body weight, or a recent substantial weight gain or loss can disrupt production of this hormone and affect ovulation. Irregular or absent period are the most common signs. Primary ovarian insufficiency, also called premature ovarian failure. Premature ovarian failure. Also called premature ovarian failure. This is usually caused by an autoimmune response or by premature loss of egg from your ovary, possibly as a result of genetic or chemotherapy. The ovary no longer produces eggs, and it lowers estrogen production in women under age 40. Hope you're understanding what I'm saying. So, too much prolactin. The pituitary gland can cause excess production of prolactin, hyperprolactinemia, which reduces estrogen production and can cause infertility. This can also be caused by medication you are taking for another condition. Damage to the fallopian tubes, tubal infertility. Damage or blocked tubes keep sperm from getting to the egg or block the passage of the fertilized egg into the uterus. Causes of fallopian tube damage or blockage can include pelvic inflammatory diseases, PID, an infection of the uterus and fallopian tube due to chlamydia, gonorrhea, or other sexual transmitted infection. Previous surgery pelvis, including surgery for ectopic pregnancy, in which a fertilized egg implants and develops somewhere other than the uterus, usually in a fallopian tube. So, we are talking about the fallopian tubes. So, if your fallopian tube is blocked, it is impossible for the sperm to get it through the blockage and fertilize the egg. So, if you have blocked fallopian tube, it can also cause infertility. Endometriosis is one of the causes of infertility. Endometriosis occurs when tissues that typically grows in the uterus implants and grows in other places. So the tissue that grows in the lining of the uterus now grows outside the uterus. That is what we call endometriosis. So this extra tissue growth and the surgical removal of it can cause scarring tissue, which can block fallopian tubes and keep an egg and sperm from uniting. Endometriosis can also disrupt implantation of the fertilized egg. The condition also seems to affect fertility in less direct ways, such as damage to the sperm or egg. Uterine or cervical causes. Several uterine or cervical causes can interfere with the egg implanting or increase the risk of miscarriage. Being polyps or tumors, fibroids or myomas are common in the uterus. Some can block fallopian tubes or interfere with implantation, affecting infertility. However, many women who have fibroids or polyps do become pregnant. Problems with the uterus present from birth, such as an unusually shaped uterus, can cause problem becoming or remaining pregnant. Cervical stenosis. A narrowing of the cervix can be caused by an inherited malformation or damage to the cervix. Sometimes the cervix can't produce the best type of mucus to allow the sperm to travel through the cervix into the uterus. Unexplained infertility. What do I mean by unexplained infertility? That is, the doctors cannot say this is the cause of infertility. They can't say this is the cause. There is no cause for the infertility. So this is called unexplained infertility. In some cases, the cause of infertility is never found. A combination of several minor factors in both partners could cause unexplained infertility problems, although it frustrates to get no specific answer. This problem can correct itself with time, but you shouldn't delay treatment for infertility. Risk factors. Certain factors may put you at high risk of infertility, including age. The quality and quantity of a woman's egg begin to decline with age. In the mid-30s, the rate of follicle loss speeds, resulting in fewer and poorer quality eggs. This makes conception more difficult and increase the risk of miscarriage. Smoking. Besides damaging your cervix and fallopian tubes, smoking increases your risk of miscarriage and ectopic pregnancy. It's also thought to age your ovaries and deplete your eggs prematurely. Stop smoking before beginning fertility treatment. Weight. Being overweight or significantly underweight may affect ovulation. Getting to a healthy body mass index (BMI) might increase the frequency of ovulation and likelihood of pregnancy. Sexual history. Sexual transmitted infections such as chlamydia and gonorrhea can damage the fallopian tube. Having unprotected sex with multiple partners increase your risk of a sexual transmitted infection that may cause fertility problems later. Alcohol. Excess alcohol consumption can reduce fertility. Excess alcohol consumption can reduce fertility. Prevention. For women thinking about getting pregnant soon or in the future, these tips might help. If you are trying to get pregnant, or if you are thinking about getting pregnant soon or in the future, these tips I'm going to mention now will help you. Maintain a healthy weight. Overweight and underweight women are at increased risk of ovulation disorders. If you need to lose weight, exercise moderately, intense exercise or more than 5 hours a week has been associated with decreased ovulation. Quit smoking. Tobacco has multiple negative effects on fertility. I'll say it again. Tobacco has multiple negative effects on fertility, as well as your general health and the health of a fetus. If you smoke and are considering pregnancy, quit now. Avoid alcohol. Heavy alcohol use may lead to decreased fertility, and any alcohol use can affect the health of a developing fetus. If you are planning to become pregnant, avoid alcohol and don't drink alcohol while you are pregnant. Reduce stress. Some studies have shown that stress can cause couples to have poorer results with infertility treatment. Try to reduce stress in your life before trying to become pregnant. So, in all this I mentioned, if you are trying to conceive, quit smoking, alcohol intake, multiple sex partners, quit all those things if you are trying to conceive. Excessive weight can cause you not to ovulate, or too much decreased weight can cause you not to ovulate. Thank you. So if you have any question about female infertility, do well to ask your question. Yes, like I told her before, she should get a medical attention by running some tests to know the actual cause of high fever. You cannot self-medicate. I cannot tell you the medication to take now. You have to run some tests to know the actual cause of the high fever so that treatment can be commenced. Thank you. Okay, so let's talk about high fever. Someone asked about it. High fever. Let's talk about high fever. So thank you for joining me. If you got a value from this video today, please subscribe, like, comment and share. Thank you.